Greetings. This video is prepared to help you get prepared to sit for the Certification in Holistic Nursing examination. It is a general overview or introduction to the process. We are always a short email or quick call away if you have any further questions. Please feel free to reach out to us. So, our intent is to help you envision getting certified, studying for the holistic nursing examination, planning for it, pursuing it, and achieving it. There are steps in the certification process. The first is the application process or applying to sit for the exam. The next is preparing for the examination, then taking the examination, and then recertifying every 5 years so you have current unrestricted credentials. What are the requirements to apply for holistic nursing certification? First, you need to have graduated from an accredited nursing program. Next, you need an unrestricted RN license. If you are an international candidate, you may maintain your own nursing license if your intention is to continue to stay and practice in your own country. Of course, if down the line you decide you want to practice in the United States, you will need to take the NCLEX in order to get an RN license in the United States. Practice or holistic nursing practice is another requirement. Holistic nursing practice is not defined by the tasks or having knowledge and skills in healing therapies, complementary alternative medicine, or other therapies, but rather it is defined on how we show up and how we interact with our clients. Our philosophy affects and guides our practice. If you believe that people are greater than the sum of their parts, that how we feel affects the chemistry in our brains, or how we feel affects our physical well-being, or our physical well-being affects our emotional or cognitive status. If you have the recognition and the belief that all the different parts affect one another on an ongoing basis, that as holistic nurses, we interact in the most vulnerable, sacred moments of people's lives, and our goal is healing and facilitating healing and quality of life, even if the person is taking their last breath, then you are practicing from a philosophical stance or model or framework of holism. So regardless of your setting or the population you work with, you are practicing holistic nursing. So holistic nursing practice, again, is not defined by skills or knowledge or expertise in healing therapies or alternative therapies, but rather it's defined by the philosophy and the way of being of how we show up when we interact with others. And the last requirement is that you need 48 CE hours in holistic nursing philosophy, theory, practice, research, related concepts, health, and care. It might relate to self-care. It might relate to healing therapies, mindfulness, or yoga, or nutrition, communication skills. Any course that comes from an accredited provider and relates to health, wellness, and well-being will help you prepare for this exam and will be accepted for the application requirement. So our next step is to plan ahead. So when you are talking about preparation, you want to think about your study plan. Where are you going to study? When and how? And your timeline is very personal. I would suggest that you think about applying when you're ready to take the exam. Once your application has been processed and approved, you will have 3 months to sit for the examination. If you need the testing period extended, you can do so for an additional minimum fee. Testing is year-round, and it is determined on the date and setting or location that you choose that works best for you. We recommend that you study using the AHNCC recommended references. There are primary references, and they are found in the handbook. You will receive the test registration materials from CNET after your application has been processed. Please read all the materials you received from them and follow the directions carefully. Contact the testing center if you have any questions. Once again, when you apply and your application has been processed, you will be notified that your application has been approved. You need to contact them within a very short period of time and let them know that you want to register for the exam. You need to register for the examination. You will have 3 months to register. Please read all the materials that have been provided to you by CNET. The primary references are the AHNCC Core Essentials, the AHNA Scope and Standards of Practice. The 3rd edition is now available, and the AHNCC Practice Examinations. Secondary references are also available. Testing strategies. Create a plan that works for you. Stick with it. Take a prep course if you think it is needed. Study in groups. Use cards to keep track of hard-to-retain information. Use positive affirmations throughout your house that state, I know what I need to do and I will be successful. Take time to relax and play. Give yourself a chance to breathe and process and retain the new information that you have learned. The National Holistic Nursing Certification Examination is offered at hundreds of sites throughout the country. It is offered year-round. Most examinations are 3 hours long. They are multiple choice, single answer. And if you have one that bothers you or makes you stop and pause, take some deep breaths, mark it, and you can always come back to it. Nurture all of yourself as you're ready for certification. Believe in yourself. Use positive affirmation. Get yourself organized. Use timetables and checklists. Pace yourself. Study in blocks. Rest, sleep, relax, and take breaks. Once you have finished the examination, you will be notified of your score prior to leaving. The day of the exam, eat a good healthy meal before you take the exam. Bring something with you that you can have in your pocket that you can use to ground and recenter yourself if it is needed. Show up early at the testing site. Set your intention, get centered, and take some extra deep, slow breaths to help you relax and access what you need to know to be successful. Recertification is every 5 years. The requirements, again, require an unrestricted RN license, 100 continuing competency hours or CE hours. There are multiple ways to get them, such as presentations, being on holistic nursing committees, publication, doing research, taking academic hours. The list is extensive and it can be found on our website. And then the practice requirements of 1 full year or 2,000 hours in the last 5 years. Thank you for listening. Please feel free to contact us at AHNCC@flash.net or go to our website, www.ahnCC.org. We are available for any questions or concerns you might have. Please feel free to contact us.